everyone. Today we'll be going over Heent assessment. We're going to do a focus history and then a physical exam. So Tiffany, this is going to be an exam of your head, your neck, your nose, your ears, your eyes, and your throat. Okay, so let me get a little history from you. Do you have a history of headaches?
No.
Dizziness?
No.
Any head injuries?
No.
Any loss of consciousness before? How about your eyes? Do you have any visual changes? Any blurry vision?
No.
No. Do you wear glasses or contacts?
No.
Have you had any eye surgery before? Any trauma to your eye?
No.
Any current or past eye diseases?
No.
Okay, good. Glad to hear. Moving on to your ears. Do you have any hearing loss? Any trouble hearing? No. Any ringing in your ears?
No.
Any vertigo?
No.
Any ear pain?
No.
Any discharge you've noticed from your ears?
No.
Okay, good. Glad to hear that. So we'll ask about your nose next. Any nasal discharge? Do you ever feel congested? Any nosebleeds?
No.
How about postnasal drip?
No.
Okay, glad to hear that. And your mouth, any trouble with your teeth? Any teeth problems?
No.
Any ulcers that you've noticed?
No.
How about bleeding gums when you brush your teeth?
No.
Okay, I'm glad to hear that. How about your throat? Have you had a sore throat lately?
No.
Has your voice been hoarse?
No.
No changes?
No.
Okay, great. Let's move on to the physical assessment portion of this exam. So first you're going to look at your patient's face and head and see if everything's symmetrical, if anything stands out, any deviations. And then you're also going to inspect your patient's scalp. So here I'm going to look at the patient's scalp. And there's no redness or any rashes or any eruptions noted. So I'm also going to now feel Tiffany's temporal arteries. So I'm going to feel right here. And those are nice and strong. So next I'm going to look at Tiffany's neck, looking for any jugular vein distension, looking at her trachea and making sure it's midline, which it is. I'm also going to feel her carotid pulses here. Those are nice and strong. And I'm also going to listen to her carotid pulses for any bruits. Okay, and those sound just fine, no bruits noted. So next, I'm going to have Tiffany drink some water, and I'm going to feel your thyroid. So when I tell you to, you just take a sip of that. So you can get behind your patient, feeling just to the sides of the cricoid cartilage, and I'm going to have Tiffany swallow. Drink some water again, and swallow. Perfect. So there was no masses noted there, no deviations, and everything was just fine. So next I am going to check your lymph nodes, okay? So we're going to start with the preauricular, the postauricular, the occipital, and you're feeling for anything enlarged or movable, basically anything abnormal. So we finish with the occipital, we'll go to the tonsillar, the submandibular, the submental. Next I'm going to go to the anterior cervical, the posterior cervical, and then her supraclavicular here. No lymph nodes were identified. So now I'm going to check Tiffany's eyes. I'm going to get my ophthalmoscope here. We're going to check for her that her pupils are equal and reactive to light and accommodation. So Tiffany, look straight ahead, and I'm going to just have you hold this card in between your eyes, please. Thank you. So I'm going to check Tiffany's eyes. The pupil constricts, her right eye constricts. So now I'm going to do this again and see if the left eye constricts while I shine the light on the right eye. Okay, and you should do that with both eyes. So next we're going to, thank you, you can remove that. I'm going to check the accommodation. So I'm going to have you look forward, and I'm going to bring this object in towards your nose, and I want you to just focus on this without moving your head, okay? Okay, and we can see that Tiffany's eyes converge and her pupils constrict. So next I'm going to check Tiffany's 6 cardinal views. So Tiffany, if you could just follow my fingers with just your eyes and not moving your head. And you want to make sure to go in all 4 quadrants. And Tiffany was able to do that with ease. So now we're going to check Tiffany's peripheral vision. Tiffany, I'm going to go behind you. Let me know when you can see my fingers, okay?
Okay. Yes. Yes.
So next I'm going to check your corneal light reflex. So you can go ahead, look straight, and I am just going to put this light, focus it on the bridge of her nose, and I'm going to watch our patient's pupils, see if they constrict. Perfect, and they are symmetrical. Okay, so now I'm still going to use this guy, and this ophthalmoscope, and I'm going to look at Tiffany's eye. I'm going to look at her right eye, so I'm going to use my right eye, and you always want to make sure to do that for maximum patient comfort. So go ahead, look straight. Notice the red reflex, and follow the red reflex, that light all the way in. So when you are close to the patient's eye, you'll be able to notice the fundus, and you can look for any scars, and there's none of that. Okay? So next I'm going to have you do the cover and cover test. So this checks for nystagmus. So I'm going to have you cover one eye. And I would like you to remove it. And you'll check to see if the pupils, if the eyes are wiggling, and they're not, so there's no muscle weakness noted. Okay? And you'll make sure to do this with both eyes as well. So now, Tiffany, I'm going to have you check the Snellen chart. So if you could stand here, you want your patient to stand about 6 feet away. If you could cover one eye, perfect, and read the smallest line possible.
FELOPZD.
Perfect. Now with the other eye covered, please. Any line.
FEOFD.
Okay, is that the line that you could read clearest?
Yes.
Okay, how about with your eyes uncovered?
DEFFOTEC.
Okay, perfect. So that would indicate that Tiffany's vision is 20/20. Okay, you can have a seat. Thank you. So that concludes the eye portion of our exam. So now I'm going to check Tiffany's ear. So you're going to look at her ear, at your patient's ear, look for any redness, any swelling, any deformities, any discharge. She doesn't have any of that. So now I'm going to palpate the pinna. Any tenderness? There's no tenderness, and you want to do that before you check it with the otoscope. So I'm going to get my otoscope here, brace it with my right hand so I can use it to keep it in place. Pull up and back on the ear, and then I'm going to visualize the tympanic membrane, and that should be pearly gray, which it is. So next I'm going to do the Weber and the Rin tests. So Tiffany, I'm going to hit this tuning fork, and I want you to tell me if you can hear it better in one ear or the other, or in the same both ears. Okay?
Same.
Okay. And so I would then check the other ear like I did with my otoscope, so just make sure you do that as well. And now we're going to check for the Rin test, which tests for air conduction versus bone conduction, and I'm going to do the same thing. I'm going to hit the tuning fork, but this time I'm going to put it on the bone behind the patient's ear, and that'll test for the bone conduction. And Tiffany, you'll tell me when you can no longer hear it, and then I'll put it beside your ear, and I want you to tell me when you can no longer hear it.
Okay.
Okay? And you'll do this for both ears.
Stop.
Okay?
Stop.
Okay, so the air conduction was about 15 seconds and the bone conduction was 10 seconds. So that's the normal finding. The air conduction is longer than bone conduction. Okay, so now we're going to check your nose. You're going to pull up, put on your light source. And there's no polyps or any redness or drainage noted. So now we're going to palpate her sinuses. Any tenderness there? Okay, I'm going to percuss them. Any tenderness noted?
No.
Great. Okay, so one more test I'm going to do. Have you stick your tongue out.
Okay.
Wiggle it from side to side, up and down. And if you could push against your cheek here and right here. Wonderful. And next I'm going to have you say ah. Okay, look in your mouth. My light source, ah again. And I'm going to check the patient's gag reflex by tickling the pharynx. Okay, and that is intact. And last test that I am going to do, Tiffany, if you could shrug your shoulders and then turn your head against my resistance, this hand and this hand. Okay, and that concludes our Heent assessment. Thank you.